Hey everyone, happy February. Today we are going to do a safety meeting and the theme is sharps. So first thing, in the portal, we're going to be going over some items in there. So we're going to talk about sharp safety and the protocols for that. So let's look at what that looks like in the portal and how you can find out that information. So if you go to the portal and you search anything and you search up sharps, you can go down here. And there's a whole thing about OSHA handling sharps. There's transporting sharps. That's talking about moving things from the operatory to the sterilization area, or if you have, your big red boxes downstairs, it shows you how to aseptically and safely move it from where the sharps are to where they need to go for the trash, not the real trash, but the biohazard trash. So if you look up the OSHA handling sharps, there's a poster, and you should all have this posted actually in your office. And it's actually really good to go over. It does, make some sense. So review this with everyone, go over this poster. It shows how to be safe, what PPE to wear, how to, talking about engineering controls and administrative controls. And engineering controls, since we're talking about that, every year you're supposed to evaluate a new safety device. So that's an engineering control. So those are things like needle recapping devices, self-sheathing needles, something like that. Test it. You don't have to like it, but you have to try something every year. And there's a form that's called device evaluation. And you go through this, you fill it out. A couple people should do it. You say, oh my gosh, I love this needle recapping device. I feel so much safer. Or, oh my gosh, I do not love this needle recapping device. I feel safer doing what I was doing. If your safest thing is doing a one-handed scoop and, capping a needle like that, and that's how you feel really safe, that's fine. It's just all about what you feel safe with. But the idea is to test new things because there's always innovations and things in dentistry, and there might be some really cool safety device that's so much safer for you. So try that. I have a couple of people fill out this form. If something goes awry, there's a Sharps injury exposure forms. You can search for that. In here, we have everything that you need for this. The easiest way to do this is through the flow chart. So basically what this flow chart does is it shows what you do, if somebody does get an exposure. Remember, an exposure is puncturing skin. It is not spilling a little something on you. You have to have a puncture or get into a mucous membrane. So the first thing obviously you do with deal with the person that got injured. Obviously you want to handle that. But the big parts of this are there's a bunch of forms to fill out. They're all here and it tells you how to do it over here. But you want to see is, does the employee want medical attention? Do they need to get some vaccines? What's the story? That kind of stuff. You want to figure out if you know the source patient. That's the easiest, right? Because then the source individual can do a blood test and then you can see, if they have anything you need to worry about. And then I was talking about the log, the Sharps injury log is really important because that's a review of why this injury happened, what you can do to train everybody so that it doesn't happen again. And you don't have a meeting that says, hey, Lisa stabbed herself the other day and, we're all going to talk about it. You can just say, we had an incident. This is what happened and this is what we're going to do now so that that doesn't happen again. And it's usually going to be PPE or like slowing down or making sure you really put the caps on the needles so that everything stays intact. So that is, so focus on those three things, double check this. This is, if you want to put this up in your office, obviously you might not want to print it out because it's a lot of ink, but this is where you go. It's really easy just to, get it in the portal here. Okay, then we're now going to talk about a medical emergency. Okay, so we're going to talk about anaphylaxis today. So that's an allergic reaction. So basically, I hear a lot of people saying to me, no one's going to have an allergic reaction here. It doesn't matter. We're not giving them anything. I'm not giving them peanuts or whatever they're allergic to. And that's true. But it's not true that no one could have an allergic reaction here. So you have other things in your office, you have latex, you have other chemicals that people may be allergic to. That's number one, right? Number two is I could be allergic to something and I could have gone out for lunch right before I came to you and I'm racing to you and, now I ate something that I'm allergic to. So that's true. The third thing that could happen is I, as the assistant hygienist, dentist, could have just eaten peanuts or could have just had something that your patient's allergic to and not wash their hands. And now it's all over the gloves and all over the room and all that kind of stuff. So just because you're not feeding your patients what they're allergic to doesn't mean that it's not going to happen to you. There's a few things in the office that you can do to save someone's life, and the allergic reaction is one of the things that you can save a life. So it's really easy to fix, and it's really important that you understand that. So an allergic reaction, there's a bunch of different signs. So somebody that just had like an itchy arm or something like that, that's somebody you could give like liquid Benadryl or chewable Benadryl to, right? That's someone that's like just a little something, that's okay. If you have more than one body system, or you have something that is involved with the breathing, you want to do an EpiPen. So some symptoms that the person may have may be their throat may be hoarse, their tongue may feel really swollen, their ears are ringing a lot of times. It's hard to breathe, they could be wheezing, anything like that, EpiPen. Sometimes people have reactions that they have stomach reactions, they throw up, they have a stomach ache. So, you can always give an EpiPen. You are not going to hurt someone by giving an EpiPen if you're worried that they're having trouble breathing. If you don't give it to them, you could hurt them. So different kinds of EpiPens. These are the basic kinds that people have in their office, right? So there's two different kinds. You may have like kind of the stick kind, or you can have this fancy AviQ kind. I'm going to show you how to use both of them. You should have trainers in your emergency kit, and you guys should all practice. Everybody go walk around and check out how to use an EpiPen. Okay. So this is the sort of the generic kind, right? All right. The way that you use an EpiPen is you take off the back part of the EpiPen, you find a thigh of the person's thigh, okay? You hold it like this and you jam it into their thigh. You can go through pants. That's totally fine. You leave it in there 5 seconds, enough so that the epinephrine in there actually goes through. If you just go like that and, tap them, it's not going to go through. Okay. So that's how you use this kind of EpiPen. This kind of EpiPen talks to you. It's very fancy. Okay. So you take it out of the package.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard down and place black end against outer thigh. Then push firmly until you hear a click. 2, 1. Training complete.
Thank you, Thigh.
This trainer may be reused for training purposes. Replace the red safety guard and gray outer case.
Okay, that's how you use it. This one kind of counts you down so that you don't just stab someone and go away. So two different kinds of EpiPens. There's the pen ones, again, some look like this, some are thinner. So just, play with what you have. Obviously, you're only playing with the trainers. Do not practice with real ones. The trainers always are gray and they will say for practice only. Really important. Also, if you have extra expired ones, people used to practice on like oranges and stuff and grapefruit. Don't do that. People get stabbed all the time like that. So only practice with the trainers. If you don't have trainers, call your medical emergency kit place and say, send me a trainer.
Remember, anytime you use an EpiPen, you always call 911. Even if the patient doesn't want you to do it, or you feel like the patient's fine, you have to call 911.
Okay, so that is it for this month. So make sure you fill out the monthly safety meeting form, write what what we talked about, what you guys learned, and who was there. And as always, any questions, feel free to reach out. Great, enjoy your February. Thanks.